Thanks, Casey. Every night at 6 p.m., we are taking you deeper into the impact of the coronavirus.
And tonight we are joined by Huntsville Hospital infectious disease physician, Dr. Hafsa Siddiqui. Thank you so much for being with us this evening.
I'm glad to be here.
Hydroxychloroquine is back in the news with word that President Trump has been taking it for more than a week. What is it and what does it do?
Hydroxychloroquine is a drug that has historically been in use to treat parasite infection like malaria and rheumatological illnesses like rheumatoid arthritis and lupus. It's the drug that is currently been in use to treat COVID-19 patients during this pandemic. Initial data came that showed some success. However, further studies came out that failed to demonstrate its efficacy. NIH recently published their guidelines stating that the use of hydroxychloroquine, the clinical data that we have available right now does not either favor or recommend against its use in the treatment of COVID-19. FDA has issued its guidelines stating that the use of hydroxychloroquine should only be used in hospitalized setting or clinical trials considering its side effects.
Now, can taking the drug then do more harm than good if you don't have malaria, lupus, or rheumatoid arthritis?
Like any other medication, if you take it without any indication, it poses some risk, and there are side effects that people can experience. And again, I would say that its use should be monitored by a physician and should closely be monitored for any side effects.
Most medical advisors say hydroxychloroquine won't help fight this strain of coronavirus, but some are still holding out hope that it will. How do decisions like these get made?
A clinical decision whether to use a medication or not should be based on data coming out from clinical trials. If clinical trials are showing a medication is successful, people go ahead and start using the medication as a treatment. However, to date, the new data that has been coming out regarding the use of hydroxychloroquine in the treatment of COVID-19 infection is not showing favorable response.
So you said earlier that and just now, in fact, that some studies showed that it could help, but why would that change? The early studies showed it could help, but these later ones don't.
There were some limitation to that study that came out initially. The patient population that was selected in that was different. So now when we are doing further trials, we are keeping all those points in mind while conducting the trials. So this data that is coming out, they have more number of patients. The treatment arms are more balanced. However, in the initial study, the treatment arm was not very well balanced. So all of these factors determine the outcome of study.
We don't want to get political, but a doctor and professor at Harvard called the president's decision, quote, irresponsible. Do you agree, and why?
I heard in the news that President of the United States is taking hydroxychloroquine. I'm not aware of his medical history, neither the indication of it in his case. I should say that the use of hydroxychloroquine should be supervised by a physician and needs to be closely monitored for side effects, as we know that it can cause heart rhythm issues.
Yeah, the president is consulting with the White House physician. We should mention that. He also said, what do you have to lose? Is this a win or lose situation?
Again, our use of medication should be based on clinical data. If clinical data is showing against it, especially the new when NIH recommended in the new guidelines, along with the combination of an antibiotic called azithromycin, their recommendation is against its use. So they're not recommending to combine its use. So if clinical data is going against its use, then we should avoid it.
There is some hope about a vaccine from biotech firm Moderna. Today, a medical news website said the company is not releasing enough information about its study. What do you know about the vaccine and what makes it promising?
Yes, Moderna is working on development of COVID-19 vaccine. They have initially done a small trial. The initial data is showing that healthy individuals did respond to the vaccine in terms of development of immune response. However, further trials are needed to determine whether this immune response will actually prevent from acquisition of infection. The company is starting their second trial, a phase 2 trial soon, and then they are planning to start their phase 3 trial in July. So the time will tell how effective is that vaccine. But I would say that yes, we are waiting for a good vaccine which we can use throughout the world in order to develop immunity to prevent acquisition of COVID-19 infection.
You mentioned the time will tell, and you even mentioned a brief timeline there, at least going through the summer in terms of the vaccine trials. But when would a vaccine be widely available?
Moderna, the company, is stating that they are planning to, if the trial goes well, they are planning to bring the vaccine in the market by fall of 2020. However, historically, vaccines have taken about 2 to 3 years to come into market. We shall see how the trials are going to go and whether they will be able to bring the vaccine in the market by fall of 2020.
Is there any chance that life returns to normal before there's a vaccine?
I think at this point we need to find a new norm. People need to be more cautious, practice social distancing, and we have to open the economy and business slowly and cautiously. And depending on how things are going after we reopen the business and economy, we have to redefine how we're going to do all of this again.
We notice you're wearing a mask today. What is the bottom line on masks? Now, early in the pandemic, masks were an option. Now they're recommended. So what's the final word on face coverings?
The more the merrier, I would say. Yes, when you're covering your face, you are not, when you're talking or when you're sneezing or coughing, you're not spreading your droplets in the air, and in the same way, you're not getting exposed to somebody else close by to when they're coughing or sneezing to their droplets. So it is a protection.
Should it be required of everyone to wear?
Now the new guidelines are that yes, it is required for everyone along with social distancing.
All right, we appreciate that. Dr. Hafsa Siddiqui, thank you very much for joining us, infectious disease specialist at Huntsville Hospital. We appreciate your time tonight.
Thanks for having me.